I started feeling out of breath, and that happened for a couple days, if not a week. A couple days passed and I started having real bad heart palpitations.
Jonathan's story starts at Medical City Weatherford, actually. We got called from the hospital that they had a patient that they were concerned about was in cardiogenic shock, which means that his body wasn't getting the blood that it needed or the oxygen that it needed to the organs because the heart wasn't able to pump it properly. The cardiologist over there called the ECMO team over here. We went over to Weatherford, evaluated him, and noted that he was indeed in cardiogenic shock. So we decided to put him on ECMO while at Weatherford because we were concerned that he wouldn't be able to tolerate the transfer over here. And we noted that, he probably had been living with heart failure for quite some time, and we were unable to take him off the ECMO machine, which is a machine that takes the blood out of the body, pumps it, does the work of the heart and lungs, and then pushes it back into the body so the heart can rest.
I was out for 12 days. I was confused. I didn't know where I was at. And that was the first thing they asked me was, do you know where you're at? I was like, no. And they're like, you're in Fort Worth, Medical City, Fort Worth. You had a heart failure.
Because he was unable to come off the ECMO, we put him on a microaxial pump to see if that would allow his heart to recover with a little bit more time. That pump pumps the blood from the heart into the rest of the body. The ECMO device and system is really meant for a shorter term period, but the microaxial pump that we surgically implant is able to be left in for weeks to months if needed. He stayed on that device for about 2 weeks. We had a committee meeting and decided that it'd be best if we proceeded with a durable LVAD, which is a surgically implanted device that patients can go home with. He did well after the LVAD was implanted.
Look who it is! Oh my gosh!
We've seen him in clinic a few times now. He's doing great and doing everything he needs to try to get his heart recovered once again. I think Medical City Fort Worth in particular, we're able to take care of patients of the highest complexity, whether they're in our hospital right now, at home, or even at a different facility. We're able to help coordinate care however we can to get the patients the care they need.
I count my blessings every single day since this has happened. I can't thank the doctors and nurses enough. I mean, everybody's been awesome to me here. I am very blessed to have met every single one of them, and I can't thank them enough for everything they've done for me.